Good afternoon. Thank you so much for tuning in to watch UBC Lunchtime News. My name is Sharon Kyomugisha. In our top stories of the day, President Yoweri Museveni has slapped a 42-day ban on public transport and rationalized curfew hours for pedestrians and border riders. This was contained in his televised address to the nation on COVID-19 pandemic update. The president said many people were floating the inter-district travel ban while Chikubu traders were deliberately overcrowding, a situation that has been fueling the COVID-19 threat.
All cross-boundary district and intra-district movement of public transport and by private vehicles or borders is hereby suspended for 42 days starting today. All cargo trucks and pickups will be allowed to travel within and across boundary districts with a maximum of 2 persons, including the driver. Public, private vehicles or border will only move to transport the patient, the ill, of whatever illness, on authentication and availability of evidence from either LFC1, RDC, or a health worker. These are the groups who depend on daily earning, especially in the towns, especially in the Kampala area. The new Prime Minister and her group are directed to quickly assess what these people need, so that we may give them support for this limited period of 42 days. Further, the Minister of Health and the Kampala City Council Authority are hereby directed to make all the necessary arrangements to ensure all individuals that require medical care and medical evacuation in Kampala Wakiso are taken care of. Across the country, the resident district commissioners working with the chief administrative officers and their district health officers are directed to make all the necessary arrangements to ensure all individuals that require medical care and medical evacuation in their respective districts. But at their own cost, not necessarily the cost of the government, because that also will delay us if we go to government money. The patients will pay and the vehicles will move them. The curfew time throughout the country is pulled back to 1900 hours from saa moja ya usiku mpaka saa 11:30 ya usiku. 1900 hours up to 5:30 hours, or from 7 o'clock p.m. to 5:30 a.m. in the morning, according to the English way. Borders will only be allowed to move only up to 1700 hours, which is saa 11 ya jioni. Saa 11 ya jioni. All schools and institutions of learning remain closed for 42 days. The Minister of Health to reactivate village health teams under the community engagement strategy to strengthen sensitization of the communities. These health centers are not too many. They are like 2,000 in the whole country. So we can mobilize 2,000 motorcycles and they start doing that linkage. The Minister of Local Government is hereby directed to support the regional task forces and the district task forces to be reactivated and supported to reinforce the compliance of all SOPs. Entebbe International Airport will remain open, but we shall ensure the no virus or new variants enter Uganda. Uganda is a landlocked country. All movements, or cargo movements to and out of Uganda will be allowed without any disruption. Cargo truck drivers at the land border crossings will be tested, allowed to move, and be followed up at the designated seclusion areas and holding places for cargo trucks. Cargo trucks should no longer park in the trading centers.
Members of Parliament say inadequate oxygen in hospitals for COVID patients, high cost of treatment and high cost testing, the disease may escalate the COVID-19 crisis. The members of Parliament now urge government to intervene and regulate the COVID-19 treatment charges across all hospitals. According to legislators, this can be done by government offering incentives or tax waivers to the private hospitals.
The increasing costs of COVID-19 treatment by hospitals across the country is worrying the MPs, saying the poor may be at disadvantage since they cannot afford such costs. According to media reports, treatment of COVID-19 in private hospitals costs between 3 to 5 million shillings a day, costs an ordinary Ugandan cannot afford. This is the reason why the MPs want government to intervene and regulate the costs.
Without any policy, it is the role of government to protect people and property. And therefore, hospitals cannot continue exploiting Ugandans who are sick, and then we keep quiet as government. Just the other day, we saw Nakarima swing into action, move around parks, arresting bus owners and attendants. Why can't we see somebody moving to hospitals and ask why there is an increase of prices unnecessarily?
Someone is taking his own measures, the way we can milk from Ugandans. Every hospital is setting its own standard, but it's a private. In Uganda, we had something called Kasao and Ingalonkaru. When you visit a medical facility, you have something, you'll be catered more. If you have no money, no one will care.
Some of the legislators have also expressed concerns over the high costs of testing for COVID-19.
Currently, we are spending 100,000. That is the cheapest fee one offers for testing COVID. That is still too high. It should come down to at least 30,000 because we are telling our populations to vaccinate after testing. But if the testing is expensive to that level and then the vaccination is for free, then it's as if you are refusing people to vaccinate. So it is better we make the testing cheap.
I'm also calling upon the owners of these private facilities to have the heart of this country. We should not use this opportunity to cheat our fellow Ugandans. We should not use this opportunity to actually, trouble our own people. The poor are now the most disadvantaged. We should take into consideration the lives of the vulnerable.
According to the MPs, inadequate oxygen in hospitals, high costs of treating COVID-19 and the high costs of testing the disease may escalate the crisis if something is not done by government.
I want to ask the Speaker at some stage that we need to come back as Parliament, see this as an emergency, and look for money to help Ugandans. Ugandans cannot die one after the other, and we are Parliament, and we are leaders, and we're just quiet about it. I think we need to come as Parliament, have a sitting specifically to discuss COVID, to discuss interventions by government, because Ugandans are dying.
We need an urgency meeting to talk about people being charged a lot of money.
Uganda has so far registered 68,779 COVID-19 cases, 584 deaths, with most of the cases registered in the second wave. Philip Aguta, UBC News at Parliament.
Now, a number of people believe in herbal therapy for treatment and that as an immune booster. Health experts, however, advise that reliance on steaming, self-medication and herbs alone may not necessarily provide the cure. Details follow from Emon Ngabo.
Lately, trends on social media show how many Ugandans are resorting to local herbs and medicines in both treatment and boosting of immunity against COVID-19. Local concoctions for drinking and steaming are all over the place, with a saying that many locals have become experts in herbal medicine. The other trend for most of the homes is self-steaming, some with water, others with local herbs, to clear the throat but also the entire body system. Steaming, though currently adopted by many, has always been around for quite some time. Many were using it for treating flu and nose congestion. Dr. Bruce Chilenga, the director, Lung Institute, is against self-steaming with herbs not fully regulated.
Steaming is actually a treatment modality which has been used for a very long time. And I'm sure when you are growing up, most people have been steamed once in a while. It has been used since the medieval times. When you look at the records, it is said to have arrived in Europe during the Victorian times. And that is the 1800s, long time ago. And all of us have been steamed once in a while. It is thought that it can treat common cold or flu. And there are three reasons which people use to advance steaming. The first one, people think heat can loosen the mucus in the airway and relieve you. People also think that heat can reduce inflammation. People also think that actually heat can kill the virus. So we can look at each of those things one in turns. COVID is not a flu as people think. It lies to us. It spends the shortest time in your nose. It knows where there is good business. It quickly translocates to your lungs, to your heart, to your brain. By the time people are seriously sick, the nose is okay. And you agree with me on this. The nose is okay. The thing has gone down. So now, even if you go to this upper airway and hit it and hit it and hit it, you are actually, the enemy has already what? The enemy has already left.
He says that steaming is not recommended as a treatment for COVID-19, though inhaling steam has been used as a home remedy for colds and upper respiratory tract infections.
When you steam the upper nose, you know steaming. I don't know whether you've ever seen it. It's actually a simple thing. Get a vessel which has hot water and cover. If the mucus is in the upper airway, you dissolve it, it comes out. Gravity will pull it out. I hope people can understand it. But if the mucus is deep down in the airways, you steam it, dissolve it, then it goes down.
The other aspect is self-medication, where many who catch a cold have resorted to prescribing drugs for themselves, a move medical experts refer to as suicidal.
Or if you are the one who is caring for this person and you see this person's mind is not so longer alert or is saying things which appear to be confused, things which are not coordinated, this person is developing severe COVID. This person must be in hospital. Or if this person is becoming very weak, has been walking around in his house managing, but now can hardly stand up, this person is developing severe COVID. The person needs to go to hospital immediately.
The UPDF Political Commissar Brigadier General Henry Matsko, on the other hand, recommended observance of SOPs set by the Ministry of Health as remedy to prevention of COVID-19.
Is really to study and go back to this standing operating procedure.
Health living through eating of fresh and unprocessed foods like fruits, vegetables and foods from animal sources are recommended by health experts.
Moving on, the director of Uganda National Expanded Program on Immunization, Dr. Alfred, says that the AstraZeneca vaccine is effective against the new COVID-19 variants. He, however, says that they are not 100% due to the fact that it has been found to be resistant to the immune system of some people.
There are a lot of misconceptions and myths, especially on social media platforms, about the efficacy of AstraZeneca vaccine against the new COVID-19 variants. A study conducted by Visa about the efficacy of AstraZeneca allays fears about the vaccine. According to the study, AstraZeneca is 60% effective against the Indian variant and 66% effective against the English variant. Both the two variants are among the many variants in Uganda.
And this kind of unresearched information which is being spewed to the community only helps to achieve confusion, and it only helps to accelerate spread of the disease because people become undecided.
In both cases, the effectiveness of AstraZeneca was measured 2 weeks after the second shot and against symptomatic disease. The dominant English-Kent variant and the feared Indian strain, both in Uganda, have been outpaced with the completion of the 2 doses of AstraZeneca immunization test. Against this globally proven test of the vaccine, Dr. Driwale says AstraZeneca is effective against the COVID-19 variants.
Then it is going to train itself and practice fighting COVID on a vaccine, so that the chemicals will be produced, the cells which eat the virus will be produced, and cells which will remember that I was once attacked will be produced. And after that, the body is ready. Should the COVID-19 virus enter your body, it will find the soldiers are ready, and it will fight the disease without giving it chance to multiply.
Despite of its efficacy against the new COVID-19 variants, the Oxford AstraZeneca vaccine is based on the virus's genetic instructions for building the spike protection. According to Dr. Driwale, the vaccine prevents development of severe disease through controlling the virus from multiplying in the body.
So it prevents severe forms of disease which will require hospitalization, which will require intubation, and which will eventually progress maybe to death. There are people who still, in spite of their vaccination status, have been found positive. There are those who have developed severe forms of disease, and indeed there are those who have died.
In the past, fears had built up in a number of countries over the safety of AstraZeneca vaccine after several cases of blood clot or brain hemorrhages in people after receiving the vaccine, with a small number of deaths reported. Dr. Driwale treated these observations about the vaccine as isolated cases, but revealed that glitches were caused by the failure of the body to make good use of the vaccine.
You see, vaccination is the act of giving the vaccine. Getting immunized is your body reacting and building antibodies ready to defend. There are people, when they are vaccinated, their bodies will not make use of the vaccine. And when we say the efficacy is not 100%, it means when you vaccinate 100 people, out of the 100, you may get 10 people who will not make use of the vaccine.
However, Dr. Driwale says the vaccine becomes effective in one's body after 14 days of receiving the injection. So it cannot protect anyone who contacts COVID-19 before 2 weeks.
You get the vaccine today, the body will take 2 weeks to mobilize its the immune system, the soldiers that fight disease in the body. It will take about 2 weeks to mobilize. Within that period, although you are vaccinated, you are unprotected. So, if you are infected within that period, the disease will move, and it is your natural body which will be fighting.
At the moment, the first dose only gives 60% protection from the disease, and one requires to get 2 doses to be fully protected. He says it is not a precondition to test before vaccination because it does not make public health sense.
What we know is 1 dose will give you immune response between 50 and 60, 1 dose. So if the level of protection is 60, then the 40% you are vulnerable. So 1 dose is protection. you are better than someone who is not being vaccinated at all. Yes, but you are not fully protected.
According to him, many people who have been vaccinated and contracted COVID-19 got mild symptoms, and some who were fully vaccinated succumbed. He explains that AstraZeneca is a non-lubricant vaccine that does not cause infection.
Many of the people who have been vaccinated, they are found positive with the COVID, and they have no symptoms, or they have mild symptoms, and they are resting at home, and they are doing well.
Uganda has vaccinated close to 1 million people, with only 60,000 receiving 2 doses. However, these numbers are very small compared to global statistics. I'm Nafka Farida in Kampala.
Where's Bob? Anyone seen Bob? Bob? Bob!
Over here.
Where?
Over here.
How did you get in there?
With my Airtel Money MasterCard.
Airtel Money MasterCard? But you don't even have a bank account. How did you get a card?
Well, it's not a card, but it works just like one. It's virtual, so no plastic, and it's safer.
But what are you doing there?
I want to buy Nancy a birthday gift, book my flight tickets, renew my Big Click subscription, and order a shipment.
For all things online, the Airtel Money MasterCard. It's not a card, but works just like one. Get one on the Airtel Money menu on your phone.
What does it mean to be closer together? It's taking the last bus home for a surprise visit. Closer together is strangers finding a connection. It's bringing home something much more than a box. It's the warmth of home, or the beginning of something new. There's magic in sharing the things that we love, because it's those things that bring us close together.
Wait, Abu, tunamaliriza. And what are you doing throwing papers all over the place?
I'm looking for an invoice for a sound system and cables that I received yesterday, but I can't find it.
You know there is a way of keeping all this in one place and available to you as and when you need it.
I really wish there was one, because the way these invoices grow legs and disappear.
I believe this is what you're looking for.
Now how did it get there?
Tabo! Do you know that with EFRIS, you can stay on track of all your business transactions and improve on your record keeping?
How so?
Katituli ku computer with EFRIS. I just search using the fiscal document number and I retrieve the records I'm looking for. Bookkeeping becomes simple after that.
Kapo, awesome, yeah.
I began using URS Kakasa Solutions and now I'm in charge of my business, and you can as well.
Kakasa, be sure you are in charge of your business.
Uganda Revenue Authority. Developing Uganda together.
Wait, Abu, tunamaliriza. And what are you doing throwing papers all over the place?
I'm looking for an invoice for a sound system and cables that I received yesterday.
You're still watching UBC Lunchtime News. Now, pedestrians and cyclists dominate roads in and out of Kampala. This follows a presidential ban on all public transport, especially taxis that people have been using to move in and out of the city. Some of the pedestrians were walking to their shops, others going for last-minute shopping, while yet others were going to work. Border cyclists that most previously used to move around at this time only allowed to transport goods and non-passengers, a situation that has made a number of people to walk. Details follow.
It's no longer what if, but a reality that the country is under total lockdown following a snap announcement by the president. This follows a steep rise in the number of COVID-19 infections across the country, now at an estimated 17% and still counting. On the first day of the lockdown, a number of people were seen walking mostly to work, to the market, and others for last-minute shopping for basic requirements.
Entambula zonna pikipiki bazituganye tetusobola zirinya tetusobola kumenya mateeka ate obuzibu abantu tetulina ssente kati nze ntambudde okuva ewa Kiso paka Kampala ngenda kutuuka ku mulimu ntuuleyo kole byenkola mmale okupaakinga nzire waka.
A snap visitor to the northern bypass and at Bwaise Junction realized that several people walking while a wheelbarrow pushers, bicycles and motorcycles were doing the transportation. Roadside vendors were still in place, but even them non-certain about the future. Police has seemingly tightened its grip on those still driving, despite the presidential ban on public transport. However, lorries and pickups are busy transporting goods to their destinations, including markets, as per the presidential directive. Kalero Market was beaming with shoppers and traders that were determined to cope with the new normal, and the authorities there are intent on ensuring it's done the way the president called for.
Ekyokusula mu katale mukulembeze yayogeddeko embeera twagiyitako omwaka oguwedde mutegese mutya kati guno omwaka okulaba nga akasada kano tumalako mu mbeera entuufu
era pulezidenti bw'aba yakyogedde tusaba tukikole nemata okuddira obulwadde butwala awaka tova twala sigala natuwa notisi tujja kibanga tukigenderako.
But for the border riders, our life seems to have hit a halt and are now pleading to the president.
Kati tuli awo tukonkomadde tetulina gwe tuvuga tetulina kye tukola ate wakati tulinaawo kyakulya wadde n'ekimu tusaba atuyambe atugenderezemu.
Abasinga emmere tuzijja mu disitulikiti ndala okugireetera abantu baffe mu Kampala tetukyasobola kufuluma Kampala genda walala. Pulezidenti tumusaba bano bamafiya abayisawo ddiiru zaabwe atusaasire amalwaliro tegaliimu ddagala tetwafunye emmere ennaku 42 ge yatuwadde. Sebo w'ekitiibwa pulezidenti tugenda bannansi bagenda kubanga bafudde enjala.
Reality seems to have dawned on the public, however, as most of them were donning masks as they walked their ways, and market vendors were visibly social distancing.
Ekizibu ekikirimu nti lockdown ejjanga tetwetegese ng'omuntu alina obusobozi bw'asobola okufuna ewalako n'abanga tabufunye ate lockdown nejja.
Omugalo gwo gutuyisizza bubi kubanga era nawali emabega kubadde kale era embeera twagirabanga ya si nnungi nawe twandibekisiraide waliyo emabega twandibadde.
However, some of the vendors want government support, at least in terms of easing transport and curfew hours on border riders, who are the main means of transportation.
Twetaaga kisa naye tujja wangula Katonda mulamu mwatumanyi tuli wano tugezaako kulaba nga twetetenkanya obulamu butambule. Kanane koko kwata kanane koko kwata kanane
The issue of banks and loans is also highlighted.
President yayogedde naye banka zituli bubi yayogedde kati ffe tutambudde ku bamanyangwa tuze tunoonye tulina zirooni President banka tazoogera kayogere ku banka zoogera tulinyisa magoba.
This is the second time in 2 years that Uganda is going into lockdown. John Barnes, Sentamu, reporting.
Thank you so much, John Barnes, for this update after the president totally locked us for about 42 days now. I think today marks the first day, and well, so many things were paralyzed, but that's the way to go until things maybe there's a difference. Thank you so much for watching UBC Lunchtime News. My name is Sharon Kyomugisha. Have a good afternoon.
It's no secret that ICT makes learning easy.
The strides made in our field could not be possible without it.